Good morning, this is Dr. Kassawat, your friendly psychiatrist. Today we're going to talk about the treatment of ADHD, but remember this presentation is for informational purposes only. So the treatment of ADHD involves three areas. Number one, medication management. Number two, behavioral therapy. And number three is lifestyle changes. But now we are going to discuss medication only. Stimulants are widely used, something like Adderall or Ritalin, and what they do is they increase the level of some neurotransmitters in your brain. Some pros include that those medications work immediately and they're fairly effective. Now, those medications have been around for decades, and there's a lot of research. They've been very effective, and they helped a lot of people. Now, the cons are that they have strong side effects such as dry mouth, constipation. They also can cause other issues such as insomnia. At times, they might have withdrawals because they tend to be stimulants, so people can withdraw at the end of the day from that medication. Other negative effects could be that they are short-acting. They also can cause a rebound where patients, when they don't have the medicine, they have worsening attention. And also, they have a risk of dependency. Non-stimulant are second-line treatment, and they include Strattera, clonidine, and Intuniv. Now, keep in mind, those medications are second-line. That means we use them when the other ones are not as effective. Strattera tend to be helpful with patients who have anxiety and attention deficit at the same time, while clonidine, that is a blood pressure medication, usually is used more for hyperactivity and patients who have a difficult time getting to bed or sleeping. Since it's a blood pressure medication, it drops your blood pressure, so people feel a little bit sleepy and they go to bed. In my practice, I have noticed that patients with Strattera tolerates it pretty good, but there are some side effects that can affect your heart. This is not as common, but it could happen. On the other hand, the clonidine side effect can include depression as well as orthostatic hypotension, meaning that when patients get up, they can fall because their blood pressure drops. Now, keep in mind, those are children who are taking a blood pressure medication. I hope you enjoyed this small presentation, and if you need many more information, please get an appointment, and we're happy to do more in-depth evaluation and treatment.